Hello, my name is Jochen Tunkel and I'm a periodontist and oral surgeon in Bad Oeynhausen in Germany. The first and probably most important thing I would recommend is just think 2 steps ahead. For example, at the moment I try to consider what measures the German government might take into account for the dental offices, what might be an obligation. For example, the obligation to use FFP2 or KN95 masks. And so I already ordered enough masks to start after the obligation comes. And up to September 2020, it is allowed to reprocess these masks. And so we already got the information how to do it, and we already wrote our work instructions to do it. So when the obligation comes, we can immediately start with the KN95 masks. That means start acting before you're forced to start, because when you're forced by executive measures, it's too late probably. The second thing is to increase stock. I give you an example for this too. The corona patients in the hospitals need propofol for being sedated, and so in the anesthesia they need a lot of propofol at the moment, and therefore they're going to change their medicine. They're going to change, for example, to midazolam. We use midazolam for sedations in our daily office too. And so I ordered midazolam for about 6 to 9 months, not running short of it. And therefore, because it's an important thing for our patients that they are sedated during the surgical procedures. And the third thing I have to say is read papers, read social medias and other sources of information. Especially social media is very good because it's very instant information. And then try to adopt what you read there to your office. For example, I read about face masks being scarce at the end of January. I read it in the daily paper, and I immediately ordered face masks for about 3 to 6 months, and that why we never ran out of masks during that time.